Hi, the purpose of this talk is to consider the evidence base around ultrasound guided injections. If we start by just thinking about what we're actually doing when we perform an ultrasound guided injection, what it actually gives us that's different from doing a surface marked injection. So the basic physics of this is that the needle, a needle, is very easily visualized on ultrasound. It's very reflective, and so it gives us a very sharp picture of the needle and allows us to, at the same time, visualize the target tissue. So as you can see from this image here, we can take the needle tip for our injection into a very specific place, whether it be a bursa, whether it be a tendon sheath, and deposit our injection in a very precise way. What it also does is it allows us to survey the area, so to ensure but to demonstrate that we are sure that there are no associated sinister pathology, lumps and bumps, vessels, nerves, etc. in the way of our injection. So in other words, we're not piercing through anything that we wouldn't want to as part of our injection procedure. And it also demonstrates, helps us to demonstrate, gives further evidence that an injection was appropriate. So for example, is there a partial thickness tear of the tendon that we're about to inject around? Things of these natures. So evidence that there was some reason why we might not want to perform that injection. Much is made of the additional accuracy, and obviously that is a very significant part of performing an ultrasound guided injection, but we've got to consider everything there that we can see on that screen, so we can see the context within which that injection is being performed. We can see what is, but also what isn't there, and also the actual journey of the needle, so we can be sure that the needle did not go through any structures that we wouldn't have wanted it to go through. So the purpose of today is to consider ultrasound guided versus non-guided or surface marked, or whatever we choose to call these other forms of injection, and consider, does ultrasound guidance improve the accuracy? Does ultrasound guidance reduce the side effects or the unwanted effects, the risks, if you like, of performing an injection? Do they improve patient outcomes? And are there other advantages or disadvantages that ought to be considered? We might start this talk by considering a statement by Finoff et al. 2015 that summarizes that there is strong evidence that ultrasound guided injections are more accurate than landmark guided injections, with moderate evidence that they are more effective and preliminary evidence that they may be more cost effective. Furthermore, ultrasound guidance is required to perform many of the new advanced procedures and will likely enable the further development of innovation of ultrasound guided surgical techniques in the future. So again, straight away, we're looking at a much broader landscape, a much broader context around this whole topic area. So first of all, accuracy. There are a number of studies, a significant body of studies, should I say, that show that consistently show that ultrasound guided injections are more accurate than surface marked injections. And you can see from our previous images and demonstrations of an ultrasound guided injection that, provided one is trained in ultrasound and knows the anatomy, is able to identify the relevant anatomy, and provided somebody has the appropriate skill then to guide a needle, they have that proprioceptive skill to be able to guide the needle towards the target structure that's being seen on the ultrasound, and it's reasonable to believe and be able to justify and rationalize the fact that ultrasound guidance does indeed significantly improve the accuracy of most injections, and that's been, so say, proven but justified, demonstrated in a significant number of studies. Indeed, one of the, I guess, the take-home messages here would be that the more difficult, the more challenging the structure is to inject, the bigger the differential tends to be between ultrasound guided versus surface marked guided injections. In other words, ultrasound guidance really comes into its own when we're injecting towards some of these more intricate structures, or where the target is smaller. So an example here was the Pezan-Serine bursa. There was a very significant difference shown. Finoff et al. 2010, ultrasound guided versus surface marked. Equally, injecting into some of the smaller joints around the hands and feet also showed a very significant differential between guided versus unguided procedures. So there is evidence, if you like, and a correlation between the difficulty of the procedure versus the advantage we get from ultrasound guidance. So systematic reviews have shown that, generally speaking, ultrasound guided is more accurate than the anatomical or surface marked guided. And that, as I say, for all intents and purposes, has been backed up by a significant number of studies. And as we said, the more difficult, the bigger the differential. Other studies have concluded that when injecting steroid, the accuracy of the placement might not matter. So there's a few key words that we need to focus in on here, okay, because not all injections are steroid. So that's one thing that we must focus in on. So most of the studies that have considered outcome measures or considered the outcome of the injection have largely looked at steroid, or almost exclusively looked at steroid. So that's something that we definitely need to be mindful of. So corticosteroid placement may not have an impact on treatment outcomes, although some of the studies suggested that that there was no difference wherever the injection was put. So this very well documented and frequently mentioned article by Ekberg et al. Suggested that putting the injection into the gluteal muscles gave just the same outcomes as injecting around the sort of actual bursa of the shoulder when it came to outcomes of shoulder pain. It's beyond the remit of this article to go deep diving into Ekberg et al., but I'm sure many of you all read and have been aware of some of the issues, if you like, around this particular, like the methodology and some of the conclusions drawn from this article. But certainly there has been some counter arguments around whether or not accuracy of injections matter. Many studies have shown only mild to moderate improvements in outcomes with ultrasound guidance. Yeah, so a meta-analysis with Wu et al. Suggested that that there was some improvement, but again, it's whether or not these improvements justify the additional cost, additional potential waiting times. Obviously, there is a much smaller cohort of clinicians that are able to perform ultrasound guided injections currently. So there was evidence of better outcomes, but then the argument then moves to is it cost effective? So does it justify the additional cost, the additional training, and potentially the sort of bottleneck, if you like, of getting people through to see clinicians that are able to perform ultrasound guided injections rather than surface mark guided injections. Obviously, there's a big training delay, if you like, to build up the number of clinicians that would be available to perform these. So the training time is quite significant, and therefore, again, it's not something that can suddenly be sort of introduced overnight. A bigger task force, if you like, for dealing with the unmet need of ultrasound guided injections. So again, another article by Sage et al. Concluding that whilst there was a difference, the difference was relatively small, and therefore questionable whether or not it justified putting all patients through an ultrasound guided injection pathway. Some studies have shown various other advantages, possibly that patients are less likely to represent in this article looking at plantar fascia injections. There certainly is evidence and articles that demonstrate that with the increased accuracy, there appears to be a significant improvement in the ability to perform, if you like, more sort of mechanical tasks, such as being able to aspirate greater volumes, and obviously these other techniques that we're going to talk about in a moment also sort of lead in from this idea that with increased accuracy that you're able to perform more intricate and more complex tasks with the injection, and also sort of more sort of advanced procedures like barbotage, like hydrodistensions, for example. So we're sort of leaning on this idea that the ultrasound guided allows us to be more accurate with what we do when the needle is in there. Here being the one that's been clearly shown in studies is by Civet et al. Is the ability to aspirate significantly greater volumes by moving the needle around within the effusion and being able to, you know, if the capsule is closing down on the tip of the needle, to be able to move the needle, or if we're against one of the folds of the capsule, again being able to move the needle tip. So that again has certainly been sort of showed and demonstrated that that people can use these more sort of technical aspects to their procedures when they're doing them ultrasound guided. But there is some conflict in the research around whether or not these advantages actually give significantly better treatment outcomes, such as to justify all of the other paraphernalia around training, around machines that is required in order to perform these procedures. And there are other reviews looking at where, you know, there was much less obvious advantages, or the conclusions were less clear cut around whether or not guided injections gave benefit, such as to say that that there has been a move towards, and certainly within some guidelines, that because there is a difficulty, if you like, to justify the funding and the additional costs and the potential greater waiting list, that some ultrasound guided injections have been removed or advised against. So the NHS England recommended against ultrasound guided subacromial injections on the basis that there was insufficient evidence of any advantage in terms of outcome, in terms of length of treatment effect, and therefore the balance, if you like, between the additional cost, waiting times, etc., led them to conclude that that patients for subacromial injections should be channeled towards the surface marked injection pathway. And again, because we're looking at a limited resource, so limited time, limited budgets, the costs of training, the length of time of training, so all of these things make access to ultrasound guided injections significantly more difficult and potentially more costly than surface marked injections. However, whilst injecting corticosteroid may not matter in terms of outcomes, is it right to attribute this to many of the other many treatments that are now being performed under ultrasound guidance? So to name but a few, we can think about high volume injections, we can think about autobiological treatments such as PRP, hyaluronic acid, and then also, yeah, some of the more technical procedures. So we might be thinking about barbotage, hydrodistension, high volume stripping procedures. So we need to think really broadly, particularly around where some of these treatments are increasingly being developed. And we also need to think broadly around what it is that we're injecting, because whilst steroid may well have a sort of cascading and diffusing of impact through the tissue, are we sure that the same can be said for hyaluronic acid injections? Are we sure that the same can be said for PRP injections and also biological injections? And certainly, although there are very little studies out there currently looking into this, could we reasonably and realistically perform a barbotage procedure without ultrasound guidance? Could we realistically perform a high volume stripping procedure without ultrasound guidance? So the move, as it were, currently towards some of these more technical and innovative treatments certainly may have more requirements for ultrasound guidance. That's something, again, that we must bear in mind. The Cochrane review also found that there was fewer minor side effects in patients having injections for subacromial subdeltoid bursa in the patient group that had the ultrasound guided versus surface mark guided. So 15% of the surface mark guided had minor side effects versus 9% of the ultrasound guided injections. So again, there may well be some additional safety benefits from doing ultrasound guided, and this, again, is an area of research that needs looking into further, particularly things like the actual placement of the needle tip to avoid trauma to nerves and to vessels, but also some of the localized side effects such as depigmentation and fat atrophy. So the actual specific placement of the needle and the layer of the tissue that the needle is placed within may have a significant benefit potentially if you're able to guide to an area which is less likely to cause some of these side effects such as depigmentation, fat atrophy, tendon trauma, neurovascular trauma. So performing an ultrasound has also been shown to significantly change the decision around whether or not to perform an ultrasound guided injection. So there are studies looking, in this case, this was looking at a group of rheumatologists, and they had quite a high percentage of the time that when they actually performed the ultrasound to survey before performing the injection, they actually changed their mind whether or not to perform an injection. And I can certainly talk from my experience. There have been many occasions where when I've actually started to scan the patient ready to do an ultrasound guided injection, we've seen something. We've seen foreign bodies within joints. We've seen foreign bodies within tissues, just as one example. We've seen partial thickness tears of tendons. We've seen, evidence of, significant flow within tissue, which then required further investigation to rule out, for example, infection or other sort of, types of pathology. So there are definitely occasions that during that moment where you scan the person ready to perform the injection, you spot something which you would not have otherwise been aware of, which leads you to either not perform the injection or to get further imaging or investigations or to refer on. So those potentially get missed if you don't perform ultrasound guided injections, and certainly in many pathways their patients will go for injections without receiving imaging necessarily for some of these like more routine procedures. So accuracy may improve our diagnosis, it may improve our clinical reasoning. There's medico-legal confirmation of the placement potentially, so you have a record, you have images that are stored which show where the needle was placed, and also importantly where it wasn't placed and what it didn't go through, what you saw at the time of the injection, and also what you were able to rule out. And there is possibly the opportunity to reduce the risk of adverse effects such as depigmentation, such as atrophy and needle trauma, by way of being able to accurately place the needle within the relevant layer of the tissue, target tissue. Other possible benefits are to assess the safety and appropriateness of the injection, as we said, particularly where there's no other formal investigations in that particular patient pathway, and allowing us to store objective evidence of exactly what was seen, where the needle was placed, and this could be really important evidence, if you like, in supporting evidence of accuracy of the injection, and also that the injection was performed reasonably. In other words, that where the needle was placed conformed with normal practice technique, and this could be really important when there was, for example, claims of damages for injury or negligence claims or other medico-legal issues relating to the injection. There has been a study which has shown that the performing ultrasound guidance, so patients actually like to watch the guidance of the needle, and this can help to reduce the anxiety through education and reassurance. So again, these are some of the softer but also potentially very, very relevant advantages and benefits. So patients feel really reassured, if you like, by the fact that you are actually guiding the needle accurately to the target tissue. So they may have less concerns whether or not that's going to improve the treatment outcome, but they like to know that you are putting the needle exactly where you want it to go. And this can give a lot of reassurance, and also to help to educate the patient about the condition and the treatment that they're actually receiving. So some of these other, again, don't get picked up so often on some of these rather binary studies about doesn't it improve treatment outcomes, but it's all about the patient experience, patient journey, and how they evaluate the treatment that they've received and the way it was performed. So, in summary, ultrasound guidance improves the accuracy of the injection, and that's been pretty much, now beyond sort of reasonable doubt, if you like. There is oftentimes recorded mild to moderate improvements in the treatment outcome. Clinical reasoning allows us to avoid unnecessary injections, so that's another potential advantage. So we know that we injected into that knee or into that bursa, so if they don't get a benefit, we might be that much less inclined to repeat the injection, because we know there's not an accuracy issue. We know that it wasn't a question that the needle just didn't quite go in the right place. And again, in terms of reassuring the patient that the treatment went to the right place. So again, we have to think about patient expectations and patient preferences. So a lot of patients will prefer or opt to be referred for ultrasound guidance of their procedures. And we live in a world of patient choice, and patient choice and preferences needs to be respected. And so that is relevant when we're deciding the services that we provide, certainly when we're planning for future services. Guided injections may reduce risk of trauma, needle trauma, less risk to tendons, ligaments, and injecting into blood vessels, injuring nerves, or even injuring the articular cartilage. So we can just place the needle within the capsule without having to test for sort of proprioceptive feedback that the needle was actually sort of like gone up against the side of the joint, as it were. It provides evidence of the needle placement and the tissues that were injected, and this can be important for a whole manner of reasons. As we mentioned, it can be evidence to support in a case of damages claim, for example, but also to just reassure the patient that the treatment was carried out in the expected way. Remember that most studies, when they're talking about treatment outcomes, are almost always looking at corticosteroid, and we know that corticosteroid may be much less of an issue where it's placed, as it were, because it can diffuse through the tissue and has an effect on the cells, as we know, through DNA gene transcription. So it may be less important specifically for steroid to be placed accurately? Does that extend to the other treatments we're using now and in the future? And that obviously needs to be looked at. Ultrasound guidance allows advanced practice procedures, hydrodistension, barbotage, and also we know that it allows the use of these other treatment techniques and developing techniques. Embracing technology may lead to further advantages in practice and treatment options. So while we're training up our workforce to perform these, we may be developing other practices, other treatment techniques again, and we will have a workforce that is ready, willing, and able to carry out these treatments as and when they're being developed. So it's important to embrace technology for the future development, potentially for injection procedures, and we know that lots of like minor surgical procedures are also now being carried out under ultrasound. So we don't want to lose this technical skill, as it were. So this is the end of my presentation, and there are some references here at the end, linked to our slides. And thank you very much for listening. And part of the ultrasound group, we provide a number of accredited and CPD courses, and there will be links also attached to this video if you're interested in finding out some more about our courses and our organisation. Thank you very much.